My name is Dr.G. Welcome to That's Unusual, my podcast uncovering the unusual stories behind the world's most interesting people. On this show, we celebrate what makes us different and how we convert those differences into unexpected opportunities. Welcome to That's Unusual. I've got one tiny request. If you are enjoying these episodes, please subscribe to this podcast on iTunes, Google Play, or Stitcher, and by leaving me a review. That helps me better understand if you're enjoying these shows and certainly keeps me motivated to produce more for you. My guest today is Dr. Shlain. Let me assure you, he is not your usual doctor. He is a highly sought-after activist and philosopher in health and medicine who provides a provocative perspective on how we can overcome the biggest challenges we face in healthcare. As both an entrepreneur and physician, he is the founder of numerous ventures in clinical practice, health technology, and media, and has had his hands in some of the greatest inventions of our time. In this episode, Dr. Shlain shares his personal story of how he built one of the most successful concierge medical practices on the backs of the Mandarin Oriental Hotel, where he learned how to deliver a 5-star customer experience for his patients. He takes us behind the scenes of how his patients helped inspire him to build his digital health venture, Healthloop, and why he believes we need a new voice in healthcare through his latest media venture called Tincture. Taking us back to his early childhood influences, Dr. Shlain challenges our preconceptions of what we believe to be healthcare and takes us on an intellectual journey of what he believes it will take to transform our health industry. As you listen to this episode, I ask that you reflect on your own unusual stories and unique qualities that can help open doors to unexpected opportunities. And so with that, let's get started. Okay, with me today is Dr. Jordan Shlain. Welcome to the show, Jordan.
Well, thank you, Gotham. Happy to be here.
I'm so excited to have you on the show. You're probably one of the most fascinating people that I know.
I wouldn't hear about that. But
you're many things to many people. You're a dad, you're a husband, you're a doctor to many patients, you're an investor, thought leader, entrepreneurial executive. I mean, the list goes on. And of course, the descriptions on a lot of your feeds and social feeds, purveyor of quality, purveyor of subtleties in healthcare, certainly one of the greatest influencers of our time. I've known you for some time now, and you stand for something much larger than the things that you do. So I'd like to just basically open up here. We're going to talk about a lot of things. But really, who is Jordan Shlain in your own words?
That's a great question. Fundamentally, I guess I'm a philosopher in search of the question. I'm less of a scientist in search of the answer. I generally find that the people that I get very close to in life are people in search of the truth. And I know that's a funny word, but really kind of beyond what's said and what exists is what's underneath that. Why did it come to be? So I'm always kind of in search of root cause phenomena and properties. And in that regard, you tend to kind of get lost in various weeds. I mean, I really think I'm an artist in search of my medium. I don't know what it is at the moment, but I'm trying lots of things. I've tried cartoons and painting, and I play in a band. I'm a doctor, so people are fascinating to me, and hence being the doctor and the art of medicine. But I don't know if that answered your question of who I am, but I'm trying to make the world a better place by focusing on the things that I believe are quality, rooted in kind of the truth again, is like, and what makes the most sense. And I fundamentally think that a lot of people in the world are kind of stuck by various paradigms that they're in. And
yeah.
In a lot of paradigms, there's a famous Persian poet who, I can't remember his name, but he said, the words you use become the house you live in. And we get so stuck on words, and those words put us into tribes, and then it's an us versus them. And then off you go. And then it's hard to go back to the beginning and give yourself permission to change your point of view on something, because there's so much momentum. But so I try to not be influenced by momentum and inertia, and try to get meta from all of that movement and go back to like the place where it all started and try to unpack that and understand what that really means today, because that was started like a long time ago. We're in a different time and space.
I think that perfectly represents and reflects who Jordan Shlain is, at least from the perspective that I see it as. So that's a great description of it. I was going to go down this path a little bit later, but I think now sort of a good place to really bring it in. I mean, your father has been a significant influence on you over the career, your late father, and your upbringing in terms of, your interest in philosophy and being a teacher and a lot of your thinking that you currently stand for today. Can you talk a little bit about some of your upbringing and your influences that have made you who you are today?
Yeah. So my father was the son of an immigrant growing up in Detroit shortly after World War II. And, he Midwestern values, which was hard work. He said, look, the four keys to success in life, he called them the four A's: being available, being able, being affable, and being and appreciative. And, and so I've always kind of led my life trying to figure out, am I those four? And how do I recorrect who I am when I get feedback to make sure that I am? And I think that one of the key drivers is being available. When someone calls or someone needs you, are you there? That's the simplest foundational aspect of humanity.
Yeah.
Because if somebody needs you and you're not there, that increases their anxiety, and then off goes the various human biases of why you might not be there. And then people dream things up and then things get confusing, and then you're kind of working backwards from a drama. So my father, so he became, all public schools, his father didn't believe in private schools. And I went to Georgetown for medical school, but I eventually, but I did public school all the way along and was kind of taught like, look, you got to like make it out there, and whatever it gives you, you got to go make it work. And he was a surgeon who brought laparoscopic surgery to the United States. He was one of the crew of people that did, because it started in France. And then when he was doing laparoscopic surgery, he started becoming an inventor, and he started got patents for devices. And then he started writing books on philosophy and anthropology and physics and art. And he was just this lion and this polymath of epic proportions that I was just like in awe of, and had a hard time ever thinking I would be even close to the plane of intelligence, empathy that he was. But he was certainly an amazing model. Now, that said, my mother got her PhD in her 40s in psychology, and even brought me down to Esalen, this hippy dippy place, not hippy dippy, but this really kind of introspective, interesting place in Big Sur. And so when I was growing up, I got both like deep psychology from my mom and deep, kind of medicine science from my dad. And my mother wrote her PhD thesis on the impact on women of female mentors. And she did that like 30 years ago.
Wow.
She was kind of so these were my influences, and both born and raised in Detroit, Michigan. And, just had a sense of ethics and values that, don't cut corners. That doesn't work. Always try to be helpful and work hard.
So I love that, they're to some degree, they're way ahead of your time, like you pointed out. And I think, that certainly has, translated into some of the work and your philosophies and way you approach things. The sense of thirst for curiosity that has really driven a lot of the things that you do. I want to raise, and I want to make sure that we get this story, covered on this show here. One of the things that I know about you is, you run one of the most successful private medical concierge practices in the country. And I think it's a model that a lot of people try to mimic. But few people actually know the backstory. And of course, you shared that backstory at one of my events last year, Unusual Intersections. But I would love for you to sort of take us back and share that journey, wherever it is that you think you need to start from. But, that journey of, how you essentially, created this model of empathy and empathetic driven approach to your patients by things that you learned by looking at the hospitality industry.
Yeah, so I guess it all started back in 1997 when I got my first job out of residency with this older doctor who was supposed to retire. And he told me, listen, I've got this great practice. I'm going to retire in 1 year. And if you work for me, I'm going to pay you very little. You're going to cover me every day and every weekend. And you're going to work really hard for a year. And then on month 11, I'm going to turn this practice over to you, or transition it. And then this is yours, and I'm going to go off in the sunset. And I thought, wow, what a great opportunity to, at 1 year out of residency, have your own practice, because back then it was HMO central, and practices were being consolidated, and managed care was coming in, and nobody was kind of going out and starting their own practice. So I spent year one in 1997 working hard, doing lots of calls for this guy while he went up to Napa with his wife. And I didn't make very much money, but that's okay. I was a cheap date. I had an old Alfa Romeo Spider dog in an apartment in San Francisco, and it just didn't matter. I was cool with it, and I had some friends. And that's what gave me pleasure. And on month 11, I kind of was licking my chops and pretty excited about taking over this practice in downtown San Francisco, far from the hospital and the politics of the hospital. Mm-hmm. And I said to him, I said, hey, listen, David, let's do this. Let's start the transition plan. And he looked at me and he said, Jordan, I am really enjoying this vacation and this, these holidays and you helping out. So let's do this for a couple more years. I'll pay you a little bit more. And I'm not ready to retire. And I literally had this moment of WTF. And by the way, that wasn't a term back then. But I looked at him and I said, no, you don't understand. We have this arrangement. We have a contract. We have a deal. But, the truth is that, if you're a doctor and your boss tells you they got other plans for you, you can't just go walk out on the street and get another job. Switching jobs as a doctor takes months of no revenue potentially to do that. So I looked at him and I said, no, you don't understand. I'm a man of my word. You're a man of your word. You must be. You're almost 80. We're going to work on our transition plan. And he looked at me and said, no, I'll double your salary though, which still, by the way, wasn't prevailing rate. And I looked at him, I said, no, you're going to sit down with me and make out this transition plan. And he said, no, I'm not. And I said, I quit. And I grabbed my briefcase and I walked out. Not really thinking through it, but it was based on being principled, not on being pragmatic. And I just figured if this is who this guy is, the next time it comes time for us to have this conversation, I just don't know what I'm going to get. I just lost trust in him right there. And I walked out and I called my father, who was the chief of surgery. And I said, hey, Dad, I just quit my job. And he said, what? You did what? He was and he was pissed at me, but he was also pissed at the doctor for reneging on his deal. And he said, Jordan, the truth is that all older doctors eat their young. That's kind of the MO of healthcare. And I didn't know what I was going to do. I said, listen, I'm just going to take a week off and kind of explore options. And I was walking down the street that day. It was a nice sunny day in San Francisco. And on every day prior to that day, I would walk to work and walk back to work because I lived about 20 blocks away. And on this day, I just looked around because I was usually walking, thinking about things, walking to work or walking home. And I stepped into this building that happened to be a Mandarin Oriental Hotel lobby, which I'd never been into in my life. But I just figured I'll stop in here and have a cup of tea. And I was having a cup of tea, thinking about what I was going to do. And in my line of sight was the concierge desk. And I just saw all this activity there at the concierge desk. And then my mind started wandering. I'm like, where are we? And I realized I was in a 5-star hotel and, I wasn't a 5-star hotel type of kid. We didn't do that with my dad. And I walked up to the concierge desk and I said, excuse me, who's the doctor you call when one of your guests gets sick? And the woman looked at me with squinty eyes and said, who are you? And I said, I could be the doctor you call when your guests get sick. And she looked at me with a pause and she said, with all due respect, doctor, she said, I may be 1-star smart, but everything we do here is 5-star service at this hotel. She said, from the lunches to the limos, we're the only 5-star hotel in San Francisco. And she said, you as a doctor are probably 5-star smart because you went to medical school and college and you took all those classes, but your industry is 1-star service. And you know it.
So true.
And I looked at her, I'm like, you're right. I'm not going to argue with that. I knew that medicine was a bit of a shit show when it came to service. And she said, if you even want to think about being the doctor that we might call, first I have to credential you and make sure you are who you say you are. But number 2, you got to bring your game up to 5-star service. So I said, well, listen, go ahead and credential me, call the hospital, call my malpractice, call the medical society, number 1. And number 2 is teach me what 5-star service according to Mandarin standards are. And she then took me under her wing, not knowing that I just quit my job and had nothing else to do. And she gave me a month-long kind of in-service on what was 5-star service according to concierge at 5-star hotels. And what I realized is it wasn't anything earth-shattering or mind-bending. It was listen with your ears, not your mouth, basically. Mm-hmm. Never be in a rush. Always anticipate what the needs are, follow up, follow through, make yourself accessible. It was kind of all the things that my dad had said, these principles going back. And, back then, this was 98 now, email was just starting to turn on. And so I said, look, here's my email, here's my page, here's my cell phone. Any guest that needs my help, I'll show up. I'll be here within 15 minutes, or I'll call back within 5. I'll answer my phone. And I just made myself ridiculously available. And by the way, what else was I going to do? I was just sitting in my apartment, reading books. And every time there was a call, I'd zip down, I'd get dressed up, make sure I was well presented, and show up and take care. And I took care of like the Prime Minister of Japan, and I took care of like these movie stars and like all these famous people. And I realized, and I would charge them a couple $100, and they would pay either by credit card or whatever. And I realized that doing this, and I got a lot of joy out of actually listening, because at the other practice that year that I was working with David, like I was seeing 20 patients a day, and I never got to finish my conversation. I always felt like I was repeating myself. I always felt like I was letting patients down because they never got to finish all of their questions and thoughts and concerns and anxieties about whatever their problems were. And now all of a sudden I had the luxury. I didn't have an appointment after this guest. I had nothing else to do. So I had all the time in the world until they said, okay, I'm done. Then I would say done, and I would give them a prescription. I would do what I would do. And it turns out that, they thought I was doing a good job at the hotel. And, one thing led to the other. And next thing I was doing about 1 to 2 house calls a week at the Mandarin. And that was paying, that was making about as much money as I was seeing 15, 20 patients a day, making like $8 a patient in copays. And I was like, something's weird here. And then I was like, this could be a business. And I walked up to the Ritz-Carlton and I said, excuse me, who's the hotel here? And they said, who are you? And I said, I'm the doctor to the Mandarin. And they said, you are? And all the hotel concierges are all in a kind of they're a tribe, really. And so they checked me out and they said, oh, wow, you are the doctor down there. We'll let you do it here. And, one thing led to the other. And within, a year or two, I had like 3 or 4 doctors working with me, and we ran the table on all the hotels. And we also realized that there were other businesses that valued getting stuff done quickly and in a thoughtful way than just price. And so all these other businesses, from airlines to cruise ships to even financial industries, they would pay me money to make myself available and to solve problems. And I think I took care of BHP. It's a big mining company in Australia, and they wanted me to talk to their board members about, something, healthcare, some epidemic. I think it was influenza. I can't remember what it was back then. But so all of a sudden I was in a world that wasn't like kind of the totally broken world of healthcare that has really been, kind of a legacy of building one broken system on top of the other until, the late 90s, when everybody was like, nobody knew who was doing what, other than you had to go really fast to see patients, and you probably weren't doing a great job, but it didn't matter because you were unhappy, patients were unhappy, and insurance companies were raking in the dough. And it was just kind of like we lost our sense of purpose and values and mission. And I all of a sudden found it. I was like, whoa, I actually can make a difference here. So what's interesting is when people say, oh, you're a concierge doctor, I kind of chuckle because I actually learned what service was, not what medicine was, from a 5-star concierge. And like, I don't tout that. And I don't really, I actually think that nowadays there's, it's like concierge medicine is like Baskin Robbins. There's like 31 flavors. Everyone's doing it differently. Most of the ways that I'm putting in air quotes, concierge medicine works is someone's got a busy practice. They say, I'm making too little. I'm working too hard. I'm unhappy. And what they wind up doing is they hire a firm to go in and they cull their patients down from, thousands to hundreds. And, the operating system of their practice is the same as it was before. It's just less patients and more money. And more power to all the people doing that. I didn't have a practice. So I built my practice from scratch. And I used every possible process, technology I could to try to put all the right ingredients in to make it so that it was truly centric to what both the doctor and the patients wanted to get out of it, not just what the doctor did or just what the patient did. So I don't really believe in patient-centric anything, because if patients are in the center of everything, what exactly are they in the center of? And this whole concept of centricity is just weird to me. I mean, it's a big buzzword out in the world today, but I actually think that medicine is really, at its core, it's a conversation between two people trying to solve a problem. And it's usually between a doctor and a patient. or and now nowadays it's the patient and the internet. Although, that's not actually a conversation. It's a bunch of monologues going back and forth. I ask the internet a question, the internet gives me an answer, but it's not a dialogue. It's serial monologues. And I think that we confuse that with what is human nature, which is, am I being heard? Is the response to the question that I just asked contextual and relevant to me? And of course the internet can't do that because it's just an internet. And anyway, so my journey of understanding what we should be building versus what many people in concierge medicine have built and what a lot of these large systems are trying to evolve into is kind of a phenomena to me, because everyone, information doesn't leak up. And, all the people at the top of all these food chains of all these systems have no clue what's happening down at the bottom. They only hear it through various reporting mechanisms. And there's all these biases and climbers that are trying to, look good, do good, and work their way up. But the bad things that are happening at the bottom, nobody hears about at the top. But, I tell people that our practice is not an organization, it's an organism. Because organizations usually have command and control structures that understand what all the facets of the organization are doing. And if one facet of the organization is not doing well, the other facets don't know. Only central command knows. And central command tries to fix it before it affects the whole organization. And with our practice, I say, look, this is kind of flat. And if the organism is failing in any facet, everybody feels it immediately. And everybody's goal culturally is to try to fix it and help it and be responsive. So at a very high level, what medicine is and should be is an expert, an empathetic expert, a doctor or a nurse or somebody having a dialogue with somebody with the lens of not just what's the matter with you and how do we solve it, but it's what's the matter with you and what matters to you. And when you put those two things together, what you find is this alchemy of trust and engagement and empowerment and results. Because the truth is, if you ask every patient from whatever their problem is, would you like the best outcome the fastest with the least probability of side effects, adverse reactions, complications, or becoming overtly and unnecessary medicalized? The answer is 100% yes, every single time. Now, if you ask a doctor, would you like your patients the same thing? They say yes. So here you have the two main actors. They both want the same thing, but they rarely both get it. And it's because this, like I said, the system is built upon broken processes. And it's really stifling as I try to go and I talk to people at the highest government levels. And then I go down into the weeds of my own practice. And I just see there's so many middlemen that don't give a crap. They're just trying to collect their data, collect their dough, move on. And what we really need is kind of a wholesale realignment and a kind of an existential question. Like, what are we doing here? What are we doing here? Are we doing this to make money? Are we doing this to help people? Most doctors go into medicine because their calling is to help people. And this big business of medicine, and I understand why some of it needs to occur, is completely deprofessionalizing medicine. And I think that a lot of them want to. They, a lot of these administrators, they sit next to a doctor, the doctor holds more kind of respect cards than the administrators do. And doctors get graded, administrators don't. And there's a concept, I forget what it's called, where the administrators kind of create power so that they didn't have before, but then they create it. And I just feel like the whole field of medicine needs a wholesale kind of re-architecture and redesign. Just because we have to go back to the roots of it. And yes, there was a period of time when doctors charged too much and it was a cottage industry and there was no economies of scale. Got it. Totally get it. And I actually applaud Andy Slavitt up at the top of the food chain for making this more about outcomes than incomes. The future incentives that CMS is rolling down and trying to open up APIs and kind of break open the silos of these big businesses that are just hurting people. And I always think about the patients that are suffering. And, we use the word readmission. Oh, what's the readmission rate? We got to fix the readmission rate. And then I think, what is a readmission? And if you actually crack open the word readmission, it's a human being suffering somewhere that didn't want to. So why don't we call readmission a human suffering failure of a system? But we don't, because we don't want to call ourselves out for failure. We want to come up with jargon. And so I think that one of the first steps that I'm really interested in recrafting language to remove jargon. So we all call things what they really are, not what we hide behind to make ourselves feel good to carry on throughout our day while we're harming people.
I mean, I think that backstory and that perspective is just so fascinating because to some degree, we don't go down to the root cause. And exactly, going back to our earlier conversation, you've got this thirst for understanding what's the root cause, what's the truth behind a lot of this stuff. And for many of us, it's really just being a hamster on a hamster wheel, just sort of running in circles and not really getting anywhere. Your whole approach in taking what you've learned in putting customer service at the forefront of what we do in healthcare, has been lost in the current world of healthcare today. And of course, now you've had your successful practice and delivered on healthcare in ways that are well ahead of its time, but actually it should have always been consistent through the time. But technology to some degree in many areas, as we talk to a number of physicians and look to healthcare professionals, has been a very, filled with lots of friction and has actually diminished our level of customer service to some degree. Can you tell us a little bit more about what you've learned in the process of building private medical and, talk a little bit about the genesis of Healthloop and how you think that's delivering on some of your core values?
Yeah. So fundamentally, I believe that there are 5 things that technology needs to do in order to be meaningful to people. Because remember, technology doesn't exist without people. We have to make it and we have to use it. And unfortunately, some of the people that make it have no idea who the people are that use it. And that's usually what happens in healthcare, which is why we have the kind of the nightmare of a technology hairball at the moment in healthcare. So the 5 attributes. So every time I think about technology now and I look at a technology, I ask myself, which of the 5 does this have? And so one of the 5 does it have preferences in it? Does the users have the ability to have meaningful preferences? Is it contextual? Meaning, does it orient you to other things around you? The other one, is it relevant? Does it mean something to you? And then the 4th one is it actionable? Can you take action at that moment? So you've got your preferences in there. It's contextual. It's relevant. And with that, I make an action. And the 5th one is it shareable? Is it easy to share? So those are kind of like the Shlain 5 attributes of technology that if you don't have all 5, if you have all 5, you've got a winning combination. And then it's just a marketing and team building game and understanding what you need to do. Because, again, if you build something that helps people, ostensibly you're going to make a big difference and win. And Healthloop was really born out of my frustration that I didn't know how any of my patients were doing after they left my office unless I called them every day, which is a synchronous activity. And you usually get a voicemail and play phone tag. And it just creates a kind of a whirlwind of documentation administeria, just plain because you have to document called patient, left voicemail. And then, of course, when a patient calls you and you're not available, it says patient called. And so all this stuff needs to be recorded in the chart. So if you think about the amount of time spent on just documenting that you tried to call them and they tried to call you, it's like a total waste of time. So Healthloop is really this proactive, asynchronous. People get messages every day by email, app, or text. We don't care. And it says, how are you doing today? And by the way, here's a little thing you need to know about today and you. So we try to package up the context and relevance and actionability. So every day a patient gets a little bite-sized bit of information. And the thing is, we know where they are in time. So if you had your tonsils out or you had a hip replacement or you just got diagnosed with diabetes, I know that you're 10 days after that diagnosis, 10 days after that visit. And I know what you need to do and what you're probably thinking because the cognitive operating system and the physiological operating system of the body are somewhat predictable. So we found that by creating this, and I call it a clinical conversation engine because we create narratives around things that are contextual, relevant, actionable, and shareable. And we have some preferences baked in, and I can talk about that later. But ultimately, what a patient, the old paradigm, no news is good news. That's what happened in the doctor's office of yore, right? Meaning, if I don't hear from them, then I guess everything's good. But the truth is, they could be in the ER in the hospital, and you just didn't know. So actually being able to track people without doing any work, I call it giving doctors a superpower. And by the way, we just we're launching Memorial Sloan Kettering and all these hospitals because they all want to use it too. They want to be able to follow up with their patients and have this sense of what I call digital empathy. is you are using a digital tool to kind of embody a human conversation, because the conversation acknowledges and respects where you are in time, acknowledges and respects what you may be thinking and providing answers and giving you the ability to take actions. So people, patients, doctors, when they use this tool, it's this ongoing feedback loop that only surfaces exceptions. So there's all this reminder alert and alert fatigue that happens all over the place. So how do you make every alert really impactful and actionable and not just, oh my God, this another alert? And so we've kind of spent the last 5 years really, really listening to patients and doctors and nurses and people who answer the phone to figure out, if you don't listen hard enough, you'll just continue to throw things at the wall and see what sticks. But if you listen really hard, you can actually not even throw anything at the wall, just build it. So we've spent a lot of time and energy listening to people to figure out what makes sense and how do we enhance their day. And it's not about enhancing their workflow, because workflow is one component workflow is really a summary of 15 different flows, from your data flow to the systems flow that you have, to the layout of your office, to the staff that you hire, to the case mix of patients that you have. I mean, workflow is a summary. So you can't change a summary without going through the kind of root cause of what leads you to that summary. And what you realize is that conversations happen at every level of that. And honoring the conversation is where you're going to actually make real change. That, again, it sounds fluffy and oh, there goes Jordan again talking about things that I don't know what he's talking about. But the truth is we have built a conversation engine that is currently, 55,000 patients per month are using it, and it's growing every month. We're getting like 350,000 data points being transacted, and these are structured, meaningful data points. It's not like some EMR garbage in, garbage out. It's patients telling us how they're doing on day 15 with their pick the diagnosis, on day 10 and day 6 and day 20. And it's them telling us how was their experience with the practice? And all of a sudden, forget, claims data be damned. That's claims data from insurance companies. It's a bunch of garbage. We're getting like data from patients, and they're telling us if they were readmitted or if they went to the ER 30 days later. Rather than trying to sift through claims data, just ask the patient. Mm-hmm. Like, they're right there. Trust them. And a lot of the medical institution doesn't trust patients. And I think that is folly. They are the best source of information that there is. So Healthloop's kind of gone on to build this platform. And it's almost like a conversation as a platform, if I was going to use that, but that sounds really silly. But it's true. And a lot of people want to be involved in the conversation, because if you have hip surgery, I can pretty much predict that you're going to need crutches, a wheelchair, and or bandages or physical therapy. And I'll tell you exactly when you're going to need it postoperatively. So imagine if during the Healthloop, it says, hey, would you like these things to show up at your house tomorrow? And it knew what your insurance plan was, and it knew which durable medical equipment had the best deal. And you just said, if you could just remove all the middlemen and say, yes, I'd like that to show up at my house tomorrow. Like, then you don't have to worry about, like, how am I going to get crutches? I got to call my sister to go pick them up for me at the mm-hmm. wall. Like, who knows? It's a total opaque system. And I want to get rid of the opacity, make it transparent, and give people the agency to get stuff done that helps them, period. And I want to give doctors the ability to get the best outcomes that they can.
Here. So this whole element of digital empathy and automating empathy, that sounds most people would think that's counterintuitive to what technology can actually serve. How would you react to that?
Well, I think if you make the technology invisible, it kind of shuts them all up. So trust is the most under-leveraged asset in the healthcare system. You can't put a metric on it. It doesn't fit in an Excel spreadsheet. It doesn't make it in the boardroom because no one knows what to do with it. But to me, trust, and when I say trust, trust really encompasses two attributes. One is, are you valuing the person in front of you? And the other one is, are you including the person in front of you? They're two different things. If you value and include somebody, and that person feels valued and included because it's authentic on both ends, you can make a huge difference. Well, so first of all, people feel empowered. And once they feel empowered because you're letting them ask questions, you're letting them be involved in the process, then they get engaged. So if trust is the driver to empowerment, and empowerment is the driver to engagement, and engagement is the driver to data and actions and activity, then I would say that digital empathy is just technology kind of like turning the human trust that we have for each other into something that you can use on a digital platform. Because the truth is that Healthloop, it's not a series of monologues. It is a genuine dialogue. And the patient knows that if they answer a question the wrong way, because they get these multiple choice questions every couple of days about where they are and how they should be doing, and it gives them information. If they answer a question wrong, what happens is it surfaces to the clinical team, who then pick up the phone and call the patient. Now, patients rarely get called by their doctor's office. They're usually the ones calling. And we've gone on to prove that by feeding patients the just-in-time information spoon-fed at the right time, not spoon-fed, but delivered in little bites over time, we can reduce the inbound phone call volume to a medical practice by 70%.
Wow.
So people don't really, like, who cares, Jordan? I'm like, who cares? Talk to the people who call, because usually you get put on hold. And people who answer the phones at doctor's office, God bless them, they're always on their back foot. Yeah. People are cranky. They just put them on hold. People are anxious. It's a job that doesn't engender a lot of pride and happiness in work, even though these people are well-intentioned. They're just, everybody who calls is cranky. So you imagine if you took those people and said, look, we're going to cut down the inbound calls, or we're going to let you call out. And what that means is that the patient realizes that this tool is connected to the people who they know and are helping them. So it's not like, some app that just, it's a chat bot, or it's not like some call center in Nevada that asks you how you're doing. This is the people that is actually taking care of you. And this goes back to kind of humanity, because I believe in humanity, and I believe that the fundamental unit of humanity is a conversation.
Yeah.
Like, that's what we do all day long. We wake up and we wake up and go to bed. All we do is we talk to people, and we listen to people, and we read things, and we try to interpret people. So, and all conversations have beginnings and middles and ends. And I believe that anxiety gets kicked up when you don't let a conversation go to the end, or you don't value or include people in the conversation.
Oh, that's an interesting perspective there. I love that. God, there's so many different directions we can go here. You're an N of one. You've got a team of many. Healthcare is going to require a systematic change. How do we get to that change? And let's go back to the philosophical roots of Jordan. Philosophically, how would you imagine that our system is going to fundamentally change in the direction that you speak of?
Well, I forget who. I think it was Margaret Mead. But if you want to make change, it always starts with a small group of people banging a drum and like really focused on an issue. So I feel like we're coming to this moment in time where healthcare is so broken. And although there are people trying to become, I think what we need is courage by the leaders in the healthcare system. As I walk through Washington, D.C. or Boston or even San Francisco, you see statues everywhere, even Europe, statues of men on horses and guys. And you're like, why did they get a statue? And it's because they had courage.
Yeah.
And they had courage to do something that stuck out, and they made it happen. They may have gotten killed, whatever. But I feel like in healthcare, no one has courage to actually make change. They're in their boardroom, they're looking at a spreadsheet, and they see that number going down, they may need to make it go up. That number's going up, they need to make it go down. And what we need are people to say, you know what? I'm actually going to do something unconventional because it's the right thing to do. And it may cost me money in the short term, but I just feel like we need courage, leadership, and the people willing to take, courage requires taking risk. And everyone's afraid of risk because they just want to get their paycheck and carry on. And there are some healthcare leaders that are taking risks, but they're risks based on courage. And that courage is based on knowing that it's the right thing to do. And the eyes of history will remember them. I mean, we're not, I don't see any healthcare CEOs getting bronze statues, but I think that that in 10 to 15 years from now, we're going to look back and there's going to be a cohort of a few people that actually made the change. And, this isn't a promotion, but I started this blog or this publication called Tincture, which you know about. And to me, it's a place where I'm trying to get people to talk about ideas that are root causey, and that can help people that don't understand healthcare understand healthcare. Because to me, it's not complicated. I mean, everything in healthcare in and of itself is simple, but when you start to stack them up into some paradigm, it becomes a hairball. And that's why people they get fatigued trying to understand it. So we need to tease out the things that work and start to leverage those. And, I tell hospital systems all the time, you can't cut your way to productivity and quality. You have to invest your way into quality. Mm. And that means you have to that's going to take some time and money, and you're going to ruffle some feathers. But on the other end of it, good things will happen, and you'll be remembered as the guy or the girl that did that. So, and I'm out there, to anybody who will listen, trying to, get them to look at what they're doing and ask themselves, are they being courageous, or are they being a leader or a follower? I walk into healthcare systems and I've talked to the CIO often for Healthloop, and I just look at hey, are you a CI yes or a CI no? Just let's establish right now whether you say no to everything or you're willing to say yes to some things. Because most people like to say no because it's convenient and it means no more work. It's kind of like if you have a brainstorming session with somebody, like any storm, after the storm, there's a lot of debris that you have to pick up and deal with. Mm-hmm. And after a brainstorming session, it just creates work. And there's a lot of people that don't want to go into those brainstorming because they want to coast. I'm sick and tired of it. People are suffering. People are dying. Doctors are getting despondent. The burnout rate of doctors is huge. And it's like, God damn it. We need to actually stop, looking the other way and look directly at the problem and figure out how we can thoughtfully, holistically solve it. And ultimately, it goes down to the conversation. Let people have, and there's too many middlemen in the system, in my opinion. There's just too many. And I think going back to what I said earlier is jargon. We absolutely need to de-jargonify medicine. And I got into a little bit of a dust up with Secretary Burwell at her office when she said, we need to make healthcare more consumer friendly. And I was like, excuse me, with all due respect, but I've never seen a consumer in an intensive care unit. And I've never seen a consumer in a hospital. So let's not conflate what a consumer is and what a patient is. Yep. Because in my humble estimation, a consumer is a mindset. And it's a mindset of I've got free will to make choices, to spend things, to get things added to my life that I didn't have. And I basically live saving money so I can have that excitement. And I'm excited. I'm excited to be a consumer because that's every marketing person will tell you, getting consumers, if you put something in front of them when they're excited the most, they'll buy something. You'll get money out of their pockets because they're a consumer and they're excited. Patients on the other end of the spectrum, first of all, they're not excited. They're anxious. Mm-hmm. Number one. Number two, they don't have unlimited options to get stuff. They have when you're told you have a hip problem, you have 3 options. So you have limited, so you're anxious, you have limited options. You actually, whatever you decide to do is not adding anything to your life. It's trying to get something back to your life. You don't have free will to make the choice. You actually have to make a choice. So you don't have free will, you have tethered will.
Having options and more choice can to some degree paralyze patients as well, right? In terms of, I don't know what to do because there's too many things presented to me. So a lot of it also depends on their trust with the healthcare system to recommend the best option of choice available to them.
Well, so this goes back to what I said earlier. It's not just what's the matter with you, it's what matters to you. And then if you've got political, religious, cultural beliefs that you should do it this way than that way, if you grew up in a hard scrabble life and you're going to do it the old fashioned way, which is I'm going to do physical therapy for 3 months every day versus I'm going to have the needle injection tomorrow and to see if I can't do the quick fix. You got to find out, you got to unpack with people what matters to them. And then you have to tailor that therapy. So I think that, again, if you listen to people and you give them some agency and empower them, they'll help you decide what they want to do that maps to their cultural sensibilities. Because healthcare tries to do first of all, there's no evidence for evidence-based medicine when you're dealing with an N of 1. There isn't.
Yeah.
And by the way, every single quality measure that exists in the world has never been through a peer-reviewed study. When we FDA approve something, a drug or a device, every metric is peer-reviewed. It's gone through studies, randomized, double-blind, controlled studies. We have never taken one quality measure through a study. So we make up quality measures and say this is quality. And it's a ham-fisted, chicanery to say that we know what quality is in medicine because we just haven't put it through. The problem is people argue, well, if you do that, then by the time you get to the end of the 5-year process, there's a new measure to be put forward. I'm like, yeah, I know. And to me, quality is really listening to people and honoring them and not trying to, shove everybody down a pathway that you want to because it looks cost effective.
absolutely agree. Earlier in our conversation, you said you're an artist in search of a medium. Do you think, is Tincture to some degree is partially your act of courage for the larger good of humanity in trying to get some of these messages and these perspectives out into the world? Where would you like to see, your new journalistic adventure with Tincture? Where would you like to see that go, and what kind of impact would you like to have that? Would you like to see with that?
It's funny. I often do things with a sense of purpose and no roadmap. And it's kind of, it's an asset and a liability. Ask people who know me. But I just feel like if you can get people talking about the right topics, one of the things in Tincture is you can't talk about your company. You can only talk about the idea behind it. Mm-hmm. So I want to remove marketing, and I call it open source thoughtware, right? It's irreverent to the status quo and reverent to humanity. And, what's interesting is I started it a year ago on a lark. I'm kind of self-funding it. It's non-commercial. We don't get any advertisements. We don't get any sponsorships. This is all just me pushing something out there. I just wanted to see if it would work. And, you were part of the original group that I was talking to people, and people said, well, what's your business model? Who's your audience? I'm like, I have no idea. I'm just going to do this because it feels like the right thing to do. Fast forward to today, almost a year later, we're getting like multiple people wanting to do submissions. I've got editors helping out. Like a bunch of people have just come together to create a little community around trying to get this message out. So I don't know where it goes. I just hope that it just continues to grow and more people realize that it's principled. It's principled in its sense of purpose, just trying to get information out to the right people to get the right conversation going. Back to the beginning, it's like everyone's looking for the answer. I'm looking for the question. What is the right questions we should be asking? And how do we like really, be okay with someone saying the question you're asking is wrong? This is the question we should be asking, and getting into that, kind of Platonic and Socratic debate about it, because everybody gets dogmatic about what they believe. And I just think, and I know the political world is not helping out, but we just need to take a step back and kind of get meta from the issues and make it okay to, be wrong, or, allow ourselves the uncomfortable luxury of changing our mind.
Yeah. Yeah, absolutely. I think Tincture is going to be a very important piece of the puzzle in terms of getting the right dialogue, the right conversation, like you said, asking the right questions and really surfacing up what are the right questions that we should be asking. So I really look forward to seeing what the ongoing developments will be for Tincture, for Healthloop, and everything else that you're working on. Before we get into some of our rapid fire sort of Mad Lib fill in the blank questions, what's next? What's next for you? What's the next chapter?
God, great question. What's the next chapter?
Or maybe you're still wrapping up your current chapter.
Well, it's funny. I feel like I'm just kind of flowing through my life. I've got 4 little kids, and I've been my wife's been gone for the last 3 weeks, so I've been breakfast, lunching, dinner, schools, homeworks, full weekends. So I've been like living like the life of my wife really for the last. It's been amazing because I've been like fully present. And I think that, presence is far more rewarding than productivity.
What's the empathetic takeaway from that experience and watching your kids full time for the past several days?
No, it's not several days, several weeks.
Several weeks.
And by the way, they range from 5 to 12. So it's I think the takeaway is, God, they're a lot of fun, and they listen to everything, and they're interested. And boy, there's nothing more important than being a model. You can tell them what to do, but if you don't do it, it doesn't matter. So my takeaway is be the change you want your kids to be. I think that's a kind of a riff off of a Gandhi thing, but
you're looking for your bronze statue right there.
Yeah, I don't need a bronze statue. I want my gravestone to say he made a difference. I'd be cool with that. So my next thing is, I'm really trying to clarify a lot of the thoughts. I use Evernote. I probably have 2,000 Evernotes of ideas and thoughts that every time I read something, I save them. And so I want to go back and look at these and then write my own series of essays. That's kind of probably my next thing. I may want to invent a smart toilet. I know that sounds stupid, but we flush a lot of data down the toilet every day. And I often think that the number one cause of cost in healthcare is the last few days in the ICU. And if you ask yourself, why is that? It's because people are in the ICU with pneumonia and dying of pneumonia. And why do they do that? Because they had a hip fracture, they fell. And why did they do that? It's because they were dehydrated or had an infection that you didn't know. And you could detect that in the toilet bowl. So if you want to go to the root cause of the cost of dying in the ICU, it goes back to dehydration and blood pressure issues and infection issues that could be detected way early on. So like that's kind of an interesting pursuit that I'm scratching up right now. Again, it's a root cause issue, but it's more of a hobby. No, I'm still in my deep philosophical, I'm turning 50 in a few months and I want to open up a kind of a more of a dialogue within myself about what are all the things I've thought about and how can I coalesce them into some kind of interesting, actionable pieces.
Yeah, makes sense. One of the things I love talking about you with is like every time I talk to you, I think I know Jordan Shlain, but I learn something new every single time. So it's thanks for sharing all of those tidbits here. We probably could talk and have a whole couple of other episodes. We might have you back on the show to talk some other things, but for now, let's wrap up. I usually ask my guests a series of rapid fire Mad Lib of fill in the blanks, and we'll do the same for you. So if you're okay with it, we'll jump right into the first.
Okay.
All right. The first one is the best piece of advice, and I know you've given tons of advice throughout this entire conversation, but the best piece of advice I ever received was.
The best piece of it's there's been a lot of them, but one of them was if you want to make change in healthcare, don't try to make money. And that came from I met with the chairman of Northwestern 15 years ago when I had an idea, and he goes, "Do you want to make money or do you want to change healthcare?" And I said, "I don't want to do both." and he said, "Well, if you have to pick one right now, what would you want to do?" I said, "Well, I want to change healthcare." He said, "Okay, well, if you want to change healthcare, it's going to take 10 to 15 years. Whatever you do to make change in healthcare, it's going to take 10. And you could make money in 15 years, but if you want to make money, you could build what you want to build and make lots of money, but the wheels will come off because you built it too fast and you didn't understand the kind of the complex freako system. It's not really an ecosystem of the healthcare universe. So I always think about that when I'm doing something is take a long-term perspective on something and be flexible, be like a bumper car and have directionality and be prepared to fail forward fast and pick yourself up and iterate.
Yeah. And few of us think that way, right? I mean, everything's become sort of the short attention span generation with our election cycles, whether you're 140 characters, that few of us actually have the patience for the long ride and the long tail. And I think that's extremely important for us to sort of bring back and have others join in. So next statement, and I know you shared a number of things that you're curious about as well, but I am most curious about.
I like to look, I like metaphors and analogs in the world. And I have been on a deep exploration of anthropology and quantum physics lately and have been reading everything I can on those topics. And I just read The Social Conquest of Earth by Ed O. Wilson, he's a Harvard anthropologist, really fascinating. I recently read The Accidental Universe, and I'm reading all these quantum physics articles. So the interesting thing I'm most curious about is the application of entanglement, quantum entanglement in our daily lives. It's a phenomena at sub-particle scale, but I feel like entanglement happens with people too. We just don't know how to define it or confine it or describe it. So I'm really curious of trying to come up with some way to get people oriented to, because things that happen on a small scale happen at a big scale, and things happen at a big scale happen on a small scale. Mm-hmm. If you look at an airplane, you see rivers and they look like the veins in your arm. And everything in biology has some analog in physical reality. And even though quantum isn't physical, it's quasi metaphysical. The universe, it seems, has some core principles that it operates on. So that's what I'm curious about.
All right, great. Now this next one, now after having a conversation with you, I almost want to rewrite it into a different question. But, if you had to write an autobiography about yourself, the title of the book would be?
It would be My Metaphorum.
My Metaphorum. Explain.
Well, a metaphor,
yeah,
and then there's a forum. So it's a combination of metaphor and forum. So it would be the metaphor of my forum. Yeah. So my Metaphorum.
Make sure you go and get that domain right now.
Yeah. But, I think about the Greek forums and the Roman forums where people would walk around and talk to each other and getting meta from that, like trying to understand why that happens and how that happens.
Yeah. Related to that, I'm going to go ahead. So after our conversation, I'm going to ask you an extra question in here. I'm going to slip it in right here based on your whole statue example that you gave. If you had a bronze statue, made of yourself, what would that metal plaque read?
Oh,
put you on the spot.
Let's see. It would read, Jordan was an optimist, even in the face of intense pessimism, and always looked for the little thing that could have a big impact, period. He tried to remember the future as best he could.
Nice plaque. So would you be riding a horse or in a self-driving car?
I would probably have 3 kids on my back. I'd be trying to read a book and I don't know.
All right.
Yeah, that's what it would look like.
No worries. All right. 2 more questions. If you could invite 3 people over for dinner, dead or alive, who would you invite and what would you talk about?
I would invite probably Plato, Nietzsche, and boy, that's a tough one. Maybe Albert Einstein.
Mm-hmm.
And I would talk about, well, obviously, like what makes a human life a meaningful life.
Mm. That's a great one. Love it. Okay, last question for you, and then we'll wrap up. So on this show, of course, we celebrate what makes us unique and different. And so if you were to fill in the blank here, how would you fill it? I'm unusual because?
I'm unusual because I don't fit in anywhere.
You don't fit in anywhere, and yet you fit in everywhere.
That's my definition of being meta.
All right. There you go. You heard it here, everyone. So, hey, Jordan, thank you so much for being on the show. You're always fascinating to talk to. Before we wrap up here, I want to make sure that everyone knows where to find more information about you. So if somebody wants to get more info about you, about your work, anything else that you're working on, where would you direct them?
My LinkedIn profile is kind of where I put all my stuff about what I'm working on and thinking about. Actually, I just opened up. I just turned on Facebook for the first time ever a few months ago. So I'm starting to put some things on Facebook that like things that I read that I think are interesting. I post on Facebook. So I'm at Dr. Shlain at Twitter, at Dr. Shlain at Twitter. I don't know where I am on LinkedIn. I think it's just Jordan Shlain. And then my Facebook page, I think, is Jordan Shlain. But those are the usual places where you can, find out what I'm thinking and what I'm doing. And then Tincture is where I try to put my voice on an editorial thesis around ideas and change in healthcare.
And the URL for that
is Tincture, Tincture.io, Tincture.io.
Tincture.io. And Healthloop?
And Healthloop is healthloop.com. And if anybody wants to submit an interesting piece, you can email me, Jordan at healthloop.com. And I would be happy to entertain, some essays.
Okay, wonderful. Well, thank you for that. And Jordan, always a pleasure talking to you. Thank you for being on the show. Until next time.
Until next time, my brother.
Hi again. It's me, Dr. G. If you are still listening, I'm hoping it's because you enjoyed this podcast. If you would like to hear future episodes, you could really help me out by subscribing to the That's Unusual podcast on iTunes and leaving a review. It goes a long way in helping me get the word out from avid listeners like you. As a thank you, I will be selecting one new reviewer each week at random for a free private 15-minute phone conversation where you can ask me anything and get professional advice on your career or business to help you stand out and make a difference. Also, if you want to be notified of any future episodes, please visit that'sunusualpodcast.com and sign up to receive updates on new episode releases. Until next time, remember to always think unusual.